Today on the podcast, I have Dr. Pamela Cipriano. She's a functional medicine practitioner, and we dive into undiagnosed or misdiagnosed illnesses such as Lyme disease. We talk about parasites. We talk about thermography, so many different things in the functional medicine space. You're not going to want to miss this one. Hey there, and welcome to the Cinnamon Effect podcast. I'm your host, Kimberly Hand, and I'm thrilled to have you with me on this vibrant journey of discovery and growth. This podcast is your go-to space for embracing intention, where you'll find clarity on your unique path, deepen those meaningful connections, and unleash your creativity like never before. We'll explore how to build unshakable confidence and celebrate the beauty of gratitude, all while savoring the calm that consistency brings to our lives. Thank you for being with me. Let's sprinkle a little cinnamon into your day and make life sweeter, healthier, and more fulfilling. Welcome to the podcast, Dr. Pamela Cipriano.
Thank you so much for having me.
You're hailing from Connecticut, right?
I am. We're finally stopped snowing.
Oh, really?
Yes, it's finally nice outside.
We're back up in the 80s. We had some cold weather down here, but no, it doesn't last too long for us in Florida.
That's awesome. That's awesome. That's my favorite state.
Oh, nice. Nice. So, Dr. Cipriano, you're known for taking on the sickest patients that have been misdiagnosed with ALS, Parkinson's, psychiatric disorders, all kinds of different things. And you have been able to uncover what is behind these triggers. And why do you believe that you are able to impact these patients on such a significant level?
It really started for me with my son, who was misdiagnosed for 10 years with Lyme disease.
Wow.
Once I figured out what it was and I went away for training and helped my son, it opened up a whole new chapter in my career, because I realized that the vast majority of providers don't know the first thing about Lyme disease. And I used to be one of them. But then I started getting patients who were sick with mold toxicity and heavy metal poisoning and parasites. And these are things that you don't normally even consider when you're working in the hospital base or when you're a primary care doctor, because you just don't have time to even think about things like this. They're not taught in nursing school. They're not taught in medical school. You know, functional medicine, when I went back to school for functional medicine, a lot of this was taught in functional medicine. So that was an entirely different way of thinking about how the body works. It was amazing. So now I get patients that have just been either ignored or told, gaslighted, where it's all in their head. Very few times do I get a doctor whose ego is not a part of the problem. Like I always say, I don't have an ego. And they'll say, I really don't know what this is, but I'm going to try and help you find somebody who does. Those are the best providers you can ever ask for, because I'm certainly not going to know everything. Nobody's going to know everything. But there's going to be somebody out there who is going to know why you have the symptoms that you have. You just have to find the right provider.
Wow. So how old was your son in this 10-year misdiagnosis?
So he was bit at the age of 6. He had the bullseye rash. He was put on antibiotics by his pediatrician for, if I have to guess, 10 to 14 days. And he was fine. He had no symptoms whatsoever. 13 years later, we went scuba diving and he had some pain in the lower abdominal area. So I brought him back to the hotel, did a really quick physical, found this tiniest hernia. While he was having his surgery, the surgeon left the operating room to talk to me. And he had already gotten in touch with Connecticut Children's Medical Center because he thought my son had a connective tissue disorder. What they found was his entire abdominal wall. They described it as Swiss cheese. So it took me 10 years to figure out what his symptoms were from. So after the surgery, whenever you have a chronic form of Lyme disease, there's a trigger. There's always something that triggers the collapse of your immune system. So for him, it was a surgery. For other people, it's a car accident or an illness or a death of a loved one. And all of his symptoms came out all at once: the brain fog, the joint pain, the difficulty urinating, the inflammation throughout his entire GI tract. And at that point, I started researching to try and figure out what was going on with my son. It literally took me 10 years. And I found one research article in the Journal of Urology that it was a case study on this one. It was an older man. He was in his 60s who had my son's exact symptoms. And I was like, oh my God, my son has Lyme disease.
Wow.
So I sent his blood work off and it was negative. From, I think it was LabCorp I used. So I sent it off to Armin Labs in Germany and it was still negative. And I was determined to get a positive. So I sent it off to IGeneX in California and it was still negative. But because of that journal article, I started him on antibiotics and I contacted the researcher who referred me to the International Lyme and Associated Disease Society, ILADS, which I had never heard of before. And I became a member. I learned as much as I could about tick-borne diseases. I found Dr. Horowitz, who's a Lyme expert, and went to training with him and then to preceptorships with him, and found out that, my son indeed had Lyme disease. And the reason he had that Swiss cheese effect to his abdominal wall was from the bacteria in his system was actually using his connective tissue as energy. So he's literally getting eaten alive from the
Wow.
inside out. So once he started with antibiotics and supplements and all, he actually got worse instead of better. And that's very, very common with anybody with a chronic form of a tick-borne disease. Eventually you get to the other side. It just does take some time. And him being my firstborn and my first patient like this, it was really a difficult process for me as a parent. It really, really was. Because every 3 weeks he would get so much worse and wouldn't want to take the antibiotics, couldn't get off the couch, and panic sets in because if he doesn't take the antibiotics, he's not going to get better. And I found one of the older meetings that I wasn't part of ILADS yet for. I was able to watch all the older meetings. It was Dr. Burrascano who was talking about the every 3-week cycle of these spirochetes, how they come out of the biofilm every 3 weeks, and that the antibiotics start kicking in and causing more inflammation in the body from all of this die-off from the antibiotics killing the bacteria. The patients actually get worse during that 3-week cycle. And so it made it so much easier for me to understand. And because of what I had to go through with my son, I was actually able to help other people, because now, every time you have one patient, you end up with another patient, you have much more confidence because now you have more knowledge of how the body works. But going back to school for functional medicine and all, I learned all about parasites and mold toxicity and, like I said, heavy metal poisoning and so many other things that go on in the body that people don't realize is what's causing cognitive decline, joint inflammation, arthritis, things that we think of as an older person's disease, but actually start at a very young age.
Wow. Can Lyme disease come back if you have been, healed or cured of it, and then even without another tick bite, can the original Lyme infection, I guess, come back?
Yes.
Okay.
So when you get bitten by a tick, within 24 hours, the bacteria uses your connective tissue or your proteins to create a biofilm. And it's like a housing structure inside your body that nothing can penetrate. Your immune system can't penetrate it. Antibiotics can't penetrate it. These are immature cells that every 3 weeks will come out of the biofilm. If you don't break open that biofilm and kill off those persister cells, you will get Lyme disease again.
Wow.
You're just not getting rid of it.
Mm.
So for my son, there was a reason why he was so sick, was because he had this biofilm, and every 3 weeks the bacteria would come out, and while he's on the antibiotics, his symptoms were so much worse because of all of the die-off. Lyme disease bacteria is a corkscrew-shaped bacteria that can evade the immune system. It sends out a signal so that the immune system doesn't even realize it's there. That's one way it evades it. Another way is it hides in this biofilm. Another way is it can hide in our own cells, our endothelial cells or epithelial cells. It can hide in our own immune system, so our own mast cells, our own white blood cells. And our immune system doesn't realize it's an intruder because of what it's able to excrete. Unlike other bacteria, like if you had, let's say, strep throat, if you take an antibiotic, the molecule will attach itself to the bacteria, and the bacteria will literally implode on itself. And our macrophages will come out and gobble everything up, goes into our lymphatic system, and we excrete the bacteria. With the spirochete like this, another spirochete that's like this too is syphilis. They both respond the same way. Rather than imploding on itself from the antibiotic, they explode. So you have all this die-off from and you're talking about millions of bacteria in your body with some patients. When you're taking the antibiotic, you're exploding so much of this that the die-off causes an inflammatory response in the body. And you end up with your symptoms are now on steroids. So you feel so much worse than you did before you started treatment. Detoxing is imperative because you need to clean out your liver. Glutathione is one of the mother of all amino acids. It's easily ingested. You can either take it with a capsule or I use the liquid, but it actually helps to clean out your liver so that it decreases that inflammatory response. Because if your liver's cleaned out, the rest of your body's going to be able to work much more efficiently.
Is that the primary way to detox that? I've taken that like gel glutathione that you like
Mm-hmm.
put under your tongue. I've also
Mm-hmm.
taken it via IV as well.
Yep. You can get a shot of it. It's so interesting that you even know what it is. That's wonderful. You can get a shot of it. You could take it orally. There's a liquid, there's a gel form, there's capsules. So you want to make sure it's liposomal. Liposomal means it's going to go right into the cell, so it doesn't have to go through your liver to get processed. But it is one of the most really important ways of decreasing the inflammation in your body. But when people come to my office, they get a whole detox packet. So I mean, that's only one way to detox. There's also, we have an infrared sauna here, something you can purchase on your own as well. That helps to detox the body. Epsom salt baths work absolutely amazing to pull the
Mm.
inflammation out of your body. Drinking apple cider vinegar is another way to increase the alkalinity of your blood, and it helps to decrease the inflammation in your body. So there's a lot of different ways to detox.
What are the most common symptoms that you find with people that have been told maybe it's all in their head, they're seeking out your assistance, but what are these most common symptoms that they're having?
The most common one is brain fog.
Mm,
I think most people come to me when they feel like they're losing their mind.
mm.
They've been to a number of doctors. The doctors can't figure out what's going on with them. They're told all their symptoms are in their head. I've had a lot of patients come to me, though, thinking that they were developing Alzheimer's disease. And a lot of times it was from a tick-borne disease that causes inflammation, decreases your cognitive ability to think properly. I don't know if you've ever had brain fog. We just
Yes.
we came back from Bahamas. So we went scuba diving. So I was already like, I'm in work mode. We went there for a really quick weekend, Thursday through Sunday. And then Monday, I've had a tooth in my mouth. I had to get a implant placed. And it's a long story. I had bad sinus infection, ate through the bone, infected the tooth. So this has been going on for over a year now, getting more bone grafts and everything. But going from vacation mode back to work, implant, the rest of the week, I did my best just to try and keep my brain about me. And I honestly never knew what brain fog felt like until last week. Last week was the first time I ever actually realized I didn't know what was wrong with me. It was like I was trying just to stay focused because patient slides are in my hands.
Yeah.
Can't figure out what is going on here. I mean, my brain just wasn't working. And I'm telling my husband, and he's like, it's brain fog. He goes, I go through that all the time when I get stressed out. And I said, oh. So my poor patients are complaining about brain fog. It's like, now I know exactly what they mean. And
Now you know.
you honestly feel like you're developing Alzheimer's disease because you're doing everything you can to just focus on one thing to get it done because your brain is going in 10 different places and it's literally foggy. It's not like you're thinking clearly of 10 different things, like usually what will happen when you have a lot of things going on. It was just this fogginess.
Wow.
So when you go to your doctor and you're explaining these kind of symptoms, they're not familiar with inflammation or inflammatory conditions or how the brain responds to bacteria, you're going to get diagnosed with Parkinson's or Alzheimer's disease or early dementia or something like that.
Wow. So, what do you start immediately with testing for Lyme disease? Someone comes in, brain fog, joint pain. Do you start there?
Usually, because usually they know that they got bit by a tick, or we live in Connecticut, so we all kind of live in the woods where I am,
Mhm.
where my office is and where my house is. But if I have somebody who says like I never saw a tick, I don't go outside, whatever the case is, I always recommend testing for tick-borne diseases because they're literally everywhere throughout the world. But I also test for mold toxicity and I test for heavy metal poisoning because you can't imagine how sick we can get just from the water that we're drinking and the amount of heavy metals that can be in just our water. Or if you're somebody who's been sickly in the past and had a number of MRIs with contrast, MRIs are much safer than CAT scans, but the contrast isn't. So I've had
Mm.
patients with heavy metals off the charts with uranium and lead and nickel and copper. And that all causes this brain fog, causes inflammation in the body. So there's a number of reasons why it would happen. But when you go to a mainstream doctor, we're not trained on stuff like this at
Mhm.
all. I'm a member of iLads and I'm on the membership committee, and we were just recently had a meeting, and I was explaining that we all had to learn about this by getting a patient that we couldn't figure out, and we needed time to research to figure out why is this happening to this patient. Where most doctors don't treat tick-borne diseases, and so their mindset isn't, oh, let me sit down and research and figure out what's going on with this patient. There is more, well, let me just give you this medication and see if we can get rid of the symptoms. And that's the American way of doing medicine, is we don't find the root cause. We don't, try and figure out what's the root cause of causing your issues. Let's just give you a Band-Aid. So we'll give you medication for, donepezil or something like that to be able to get more blood supply to your brain, which I've never seen work, to be honest with you. It's just one of those boxes you check off to say, okay, well, I give them a medication for Alzheimer's disease, even though it's not going to work.
Interesting. So
Yeah.
you said, ticks are all over, right? I've spent time in Tennessee. There's ticks there. Is there a certain region of the country where ticks are more predominant, or people see more cases of Lyme disease in those areas?
The Northeast of the United States is going to be the highest area of tick-borne diseases. Now, I don't know if it's because if it originated here, or if it's because we have the most amount of woods, or what it is. I'm not really sure what the reason is. But when you look at the CDC chart of where epidemiologically the Lyme disease predominantly is, it's in the Northeast. So it's anywhere from Maine down to New Jersey, I believe.
Okay. Okay. And so when someone comes in and you are, even if they've been diagnosed with something else, such as ALS, or I feel like with Eric Dane passing of ALS, it's been in the news. And I don't know if you saw his kind of last speech type thing that he put out there. How are you taking, someone who has had a diagnosis like that, and you're saying, listen, we need to reevaluate this? Are you testing them for Lyme at that point and saying you believe that it could be Lyme disease?
So I actually Googled him, and I was able to find his publicist and sent an email to I sent a couple of emails out regarding him, because there was no way for me to get in touch with him.
Mm.
For him to go on the ILAD site and see if there was a doctor that was close by for him. But this could have been a tick-borne disease that is reversible. The problem with ALS, it's a very fast disease process. If you don't have the gene for ALS, there's a good possibility it's not ALS and it's just being misdiagnosed because of a tick-borne disease. The tick-borne disease is usually related to Bartonella, Lyme disease or Bartonella, but Bartonella is always the one that's going to cause more of the neurological problems.
Mm.
So I have two patients misdiagnosed with ALS, and both came to me at a very late stage, which was so unfortunate. One is only 44 years old. She started with foot drop and progressed very quickly. Her family didn't want to accept the diagnosis of ALS, and so they found a naturopath who tested her for all the tick-borne diseases, and it came back positive for Bartonella. And she was referred to my office. But by the time I got to see her, she was already paralyzed from the neck down.
Wow.
And a week later, she was going to get a trach because she was already having difficulty breathing on her own. I had a PICC line placed immediately. We started her on treatment immediately. We had gotten IGeneX testing and everything, and she was positive for Bartonella and Lyme disease. But there was nothing we could really do to get the motor skills back. Once
Wow.
they're gone, they're gone. So that is exceptionally sad. She has the greatest outlook I've ever seen in anybody. She is an amazing, amazing individual. She is the most positive person I've ever met. She's no longer able to speak. She has an iPad that has the letters on it, so she's able to look at the letter. There's a device that she was able to get through occupational therapy, where she can spell out what she wants to say, and then it's a robotic voice that will, ask the whole question or speak in paragraphs and all. But physically, she's not improving. Like, there's only so much you can do once you get to that point. So the reason I do these podcasts is patients could get to me a lot sooner. I can get them on treatment a lot quicker and prevent this dire disease process from progressing.
Yeah.
The first person I had that had Bartonella, she was seeing a different line doctor, and something happened in the office where they just forgot to order the Rocephin and forgot to order the PICC line. And so she ended up coming to my office. And so, we got the records and all, and we got the PICC line placed and everything. But by the time she saw me, she was already in a wheelchair.
Mm.
And she had already lost her ability to ambulate without assistance. And I wanted her to go to Columbia University because they do specialize in Lyme disease there in the city. And she just felt that her husband had just retired and he was driving her all over the place for treatment. And she wanted to stay local. So they ended up going to Yale, who isn't the best hospital to go to for tick-borne diseases.
Mm.
The neurologists there were amazing, though. Like, they felt that she had ALS, but they really weren't sure yet. And so they were going to be doing some further testing. And so she comes to see me after she saw them. It was a Friday. She left my office around 6:30, and I had left myself a note on my desk to call Yale on Monday morning to say, if you think this is a disease, let me know what to do, because she's not going to survive. And
Mm.
Monday morning, I came into my office with her death certificate on my desk.
Oh.
So that was, I could finally talk about it without crying. I'll be honest with you. That rocked my world. It really did, because I had no opportunity to even help her.
And if people just knew about what you're doing and the work you're doing, at least get the test, right? Get the test and
Yep.
see if you're testing positive for something like that.
Yeah, because there's a number of things that can take us out in this world. There really is. But something like that is reversible. Like if you find a doctor who really knows how to treat it, it is reversible. Somebody like that who's in a wheelchair, they're immediately going to get IV antibiotics because it's affecting their nervous system. So we have to use something that's going to penetrate the blood-brain barrier.
Is that always the protocol? Is the protocol kind of the same for each Lyme patient that comes in?
Now, we try not to use the PICC line unless we absolutely have to, because like with any procedure, there's going to be risks, inflammation. We can puncture a main artery. We can cause bacterial infections in the heart. So it's something we don't want to use unless we absolutely have to. But it depends on how long you've had Lyme disease. If you only have Lyme disease, or do you have Bartonella or babesiosis or ehrlichiosis or tularemia, brucella, Rocky Mountain spotted fever, it goes on and on and on. So the treatment is based on what bacteria do you have, what parasites do you have, and is there something else going on? So if you do have, let's pretend you do have simple Lyme disease. Not that it's simple, but it's not with another co-infection. But I don't know that you're living in a moldy environment. I'm
Mm.
never going to get you better, because now this mold is causing even more issues in your immune system. So it decreases your immune system's ability to even fight off any diseases, where with Lyme disease, you're already having a difficult time fighting off this disease. So we need to get rid of the mold first, and then we can treat the Lyme disease. So it's a process to really find out, you know, really starts from childhood. How did you grow up? What kind of a house did you grow up in? Are you ever exposed to mold? What kind of water did you drink? Do you have lead pipes in your house that never been changed? Is there lead in your water? There's a host of things that you have to think about whenever you're treating a patient that has multi-system disorders, because it affects every single part of the body.
Yes, I'm familiar with mold. I've had mold. What was so interesting to me is that when I took the test, could it be mold that I was exposed to when I was a child, like you said? Or was it current mold? Is it something that is in my environment now? Is it, I just went on vacation and stayed, you mentioned the Bahamas. I stayed in a place in the Bahamas and I could see there was mold in the bathroom. Is that
Mm-hmm.
contributing to it, right?
Yep.
So, mold is so tricky. So, do you find that typically people that have this suppressed immune system, whether it's Lyme disease or Epstein-Barr or anything like that, they are also struggling probably with underlying mold issues?
Mold is a huge problem, and it's so poorly understood. We live in Connecticut. On the news, they were talking about one of the schools that they found mold in the computer lab, and they closed the room down. They had to get company in. There's mold in every single school in the state of Connecticut, unless it was just recently built. These schools are so old. You have these curtains that are hanging in the auditorium because they're like on the stage,
Yes.
filled with mold.
Yep.
There's so much mold that people don't even realize. And when it ever came out, they were like shocked. This school had mold in the computer lab. I looked at the TV, and my husband there. I'm looking at the I'm yelling at the TV. There's mold in every school.
Yeah.
What are you talking about? Like, it's just a brand new thing they just discovered.
Yes, I wanted to buy an air purifier for my son's classroom. I thought, well, at least I could do something, like
Yep. Yep.
and I to say that because I think, you could be going to a gym, let's say, or somewhere where you're spending time, even if you're spending like an hour a week, right? And if it has mold, then that can severely affect your system.
It can. And mold is airborne. It is such a tiny little molecule. It's going to get through almost any mask that you can possibly use. And now you're at the gym, we'll say, for example, and you are just huffing and puffing, trying to get those, last bit of reps in. You're infiltrating your body with all of this mold, which is going to really disrupt your immune system, causes inflammation, causes a disease, immune dysregulation. So it's, I never have a patient who comes to me with just mold toxicity or just Lyme disease or just heavy metals. It's usually a combination of a few things.
Mm. So what do you do? What kind of mold protocol do you implement for patients?
First, if they're still residing where the mold is, they have to get rid of the mold. That's the most important thing. I had a patient that every time I gave her a binder to take to get rid of the mold, she was getting sicker instead of better. And I said to her, you must still be in a moldy environment. Nope, we moved out. Before I moved into this apartment, I checked it. I made sure. I said, the mold might not be right in your apartment, but it's going to be in that area, because when I'm giving somebody a binder, it's pulling the mold off of the receptor in the body. If they're in an environment where there's still mold is now going to infiltrate their body and replace that receptor, and they're going to get sicker instead of better. It's not even like they're going to stay status quo. They're going to actually get worse instead of better. So I know that they're still in a moldy environment. And so they did some more extensive testing, and sure enough, she had mold in her new apartment. So now the parents moved her out of the apartment because she was so sick. She was so sick. I didn't think she was going to survive it, honestly. She was so mismanaged by the mainstream doctors. It was so sad. She had unnecessary surgeries. The things they did to this poor girl were just so ridiculous. Nobody was thinking logically. They were thinking surgery. They were thinking like out of the box kind of stuff. So she was having surgeries for constipation, like literally doing bowel resections because she was so constipated. What I'm going to say is going to sound so absurd. I even felt funny to ask her this. I said, did you ever try magnesium oxide? And she looked at me and she goes, I have been on every medication possible to help me with a bowel movement. I said, I would just try it. I said, you can't overdose on magnesium oxide. It sits in the bowel, pulls fluid into your colon to help you to have a more normal bowel movement. The worst case scenario, you're going to you'll have diarrhea. Do you know that that's what she needed?
Wow.
She had a teleconference with her GI team, and she told them that every one of them failed her because this is all she needed was this magnesium oxide. So, like, people don't think of how easy the body can actually heal itself if you give it the right information. For her, she was lacking the magnesium. She just needed something to help flood her colon with more fluid and be able to have a normal bowel movement. I don't know if you could see my
I was going to bring him up back there because I said, I see a dog.
She's been sleeping this whole time. She slept through the whole podcast before this one.
Oh, is she? What's her name?
Mocha.
Mocha. Oh my God. Mocha's so cute. I saw her
Mocha
little
is
face and I
so
was like, oh my
spoiled.
God. I love it. So because we're all exposed, I think everyone is exposed to mold at so many different times, whether it's in your environment or not. What do you suggest? Because this really affects me because I've had testing that has shown that I had mold. And then my brain just goes crazy of like all the ways I'm getting exposed on a day-to-day basis. So what can we do? Is there anything we can do to like combat the mold in our daily life? That's considering, say, our home environment is clean and there's no mold there. So we're living in a clean environment, but we're obviously being exposed to it in different places that we go, we visit, we travel, we do this. So is there anything we can do to kind of keep ourselves as healthy as possible?
So there's a lot of different reasons why you would have mold. It could be where you're residing. It could be the water you're drinking. It could be environmental. So something that's going on in your environment itself, not necessarily where you're residing. It could also come from food. Certain foods are going to be higher in mold than others. Something like coffee can have mold. Peanuts could have mold. Things like that. The only thing I would recommend is, you don't want to stay on a binder for an indefinite amount of time because it's something you just don't necessarily need. But if you feel like you're developing brain fog, you're starting to develop the inflammatory signs and signals, the joint pain, the difficulty having a bowel movement, headaches, those are typical mold kind of symptoms. Binders are amazing. The one I recommend is from Quicksilver, and it has charcoal, bentonite clay, zeolite, artichoke, like all really natural things to be able to bind to the mold. And also to certain heavy metals if you have those in your body as well. Take it once a day. I would stay on it for, if you're going to be in an exposed area, maybe a week or two. But if you're really symptomatic, you can take that until your symptoms subside. And that would be a really healthy way because you're not taking anything that's going to hurt you. Just remember, whenever you take that, you have to take it at least 3 hours apart from anything you're eating or drinking. Because if you don't, that's what's going to get pulled out of your system and not the mold. So you just want to make sure it's on an empty stomach. I usually tell people to take it before they go to bed, because that way it's, have dinner at say 6 o'clock, 9 o'clock, take the binder. Make sure you drink it with a good 8 ounces of water, because it can dehydrate your intestines. And that's a perfectly good way to try and just get your body back to normal.
I've taken GI detox before. I don't know who that's
It's
made by.
very
I can't
similar.
remember. Yeah.
Yeah, very similar.
Binder. Do you ever implement any ozonated IVs? Like, what are they called? What's the formal name for them? Where they take the blood out, they ozonate it and put it back in. Is
Yeah,
that
the
part of?
ozone therapy. I don't do it here. There's a lot of controversy on something like that, a lot of lawsuits on something
Mm.
like that. So that's the reason why until it becomes more standardized, where it's a much safer treatment, I don't do anything experimental. I do things that I know are going to help the person, and anything carries risk, but at least I want to be able to limit the amount of risk that I'm giving to somebody. And if there's other things that I can do to heal the body, I'm not going to use something that might be more detrimental.
What do you think are the biggest blind spots in the conventional medical system when it comes with these undiagnosed or misdiagnosed illnesses?
That's huge. And I think it's awful what people have to go through to get a diagnosis. I always refer to the ego, and I always refer to myself that I honestly have no ego. If I don't know, I'm going to tell you I don't know, and I'm going to find somebody who's going to help you. But the provider who just feels like they know everything, and if they can't figure it out, nobody can figure it out. So it must be all in your head, needs to find another job. We'll put it that way. They need to get out of medicine, because nobody deserves to be on the receiving end of a statement like that.
Mm-hmm.
And the vast majority of my patients, that's what they've had to go through. And let me tell you, that whittles away at your self-esteem, at your ability to even think clearly of is this really all in my head? That's what happened to my son. When I called him and I realized what he had, and I told him this is going to be from a tick-borne disease, he said to me, the poor kid said to me, "No, mom, they told me it was all in my head. They told me I have to go see a psychiatrist." I said, "I'm telling you right now, this is not all in your head. This is an actual thing that's going on." And it was because I had read a research article in Journal of Urology. That's the only reason I even knew what was going on with him, because his symptoms were so vague. I hadn't had a patient like that before. I was a critical care nurse. And after that, my master's degree was in acute care. So it was more critical care, hospitalist, Department of Surgery, ER, and everything is medicine, because we're trying to save somebody's life. But it was when I went to work for another provider whose partner had retired that was the first time I ever got into primary care, which I never thought I would ever do. But they needed somebody who knew how to admit, discharge, round in the hospital. So I took the position. Wow. If primary care providers were better educated, there would be such a lower amount of people hospitalized. We'll put it that way. Because the amount of education they get, or the amount of time they have to research an issue, is so low that these people are just hospitalized and rehospitalized and rehospitalized and misdiagnosed, constantly misdiagnosed. It was really sad. When I opened up my own practice, now I have my doctorate degree. I went back to school for functional medicine, and that was like the missing piece that I had.
Wow.
That's when I learned all about mold toxicity and heavy metal poisoning, and not so much about the tick-borne diseases. That was more through ILADs and finding providers myself to study under. It was a real eye-opening experience of what is wrong with our medical system. We don't have a great track record in the United States. We really don't. Not at all. I mean, the amount of medical malpractice that occurs is astronomical. It really is. And the amount of people who suffer from that because they're just not getting the right information is awful. And basic testing just doesn't do it. A lot of times people have to pay for their own testing if they want to get an accurate result.
Right. And a lot of people, I think, the cost of getting this extra testing, and a lot of insurance companies won't cover certain testing, does shy people away from going down this route. I was having a lot of issues, and I had reported it to a doctor, and they said, "Oh, but your blood work came back fine." Right.
Mm-hmm.
And I think
Mm-hmm.
they tested for like my vitamin D levels. They did this very like basic testing. Right. And I thought, I just am feeling like no, this isn't right. And then I saw a functional medicine practitioner, and man, it opened up my eyes. Maybe not in the best way, because I realized I had a lot more going on, like under the hood of my car, than I thought I
Yes.
did. Right. So it was
Hmm.
like very eye opening for me that, I need to do this. And this was 5 years ago. And now I think a lot more people are more familiar with functional medicine.
Yes.
And yeah. So what would you say to somebody that, maybe has their blood work looks normal and their doctor has said, "Oh, your blood work is in normal range," but they still aren't feeling well? What is your advice to them?
They're not getting tested properly. So they should find a functional medicine provider who does know how to test different ways. Our insurance companies mandate what we can test. A lot of times if you pay out of pocket, like in the state of Connecticut, and I don't know if it's nationwide or not, there's a lab called Ulta Labs.
Mhm.
Ulta Labs is a subsidiary of Quest. So Quest owns it. Quest takes insurance. So a test like vitamin D through Quest is $250. If your insurance company decides I'm not paying for it, you're stuck with a $250 bill. That same test through Ulta Labs, which is part of Quest, it's the same facility that tests the blood, whether it's Quest or Ulta Labs. Same facility tests the blood. It's just billed differently. That same test is $25. So 10% of what the insurance requires. In other words, it's the insurance companies that drive up these prices. If I need an MRI, I know I'm going to pay between $1,200 and $1,500 if I go through my insurance. If I pay for that same MRI out of pocket, it's $500. So you have to be a really smart consumer too to really
Mhm.
know how much is this going to be if I pay for it out of pocket. Is it
Mhm.
going to go towards my deductible? No. Well, that doesn't matter because my deductible is $14,000, so it doesn't matter anyway.
Right.
When you really try and figure out, can we skip going out to dinner a couple of times a week and maybe pay for something like this? Like you have to really balance it, especially if you're on a budget.
Yes.
Your health should mean more than anything else ever. Because if you don't have your health, you have absolutely nothing.
I couldn't agree with
Nothing.
you more. And I've actually, because I've talked openly about it on this podcast, and people are like, "Oh, but that's so expensive," and this and that. And guess what? It's worth it to me, and I will sacrifice in other ways, to get it.
Yeah, exactly.
And there's a lot of people that are opting now for just, what do they call the insurance? Just of is it not catastrophic, but if something really bad happens, like major medical, but then paying out of pocket for all the other things, because if you're choosing not to go the conventional route, then you will be paying out of pocket for a lot of it. So not putting that towards these insurance premiums and all of that stuff. So you have to be savvier, I think, and you have to do your research and figure out what option is right for you, of course. But
We have to get that mindset of insurance companies out of your vocabulary. I had a patient who came in, he was fishing and somehow he twisted his leg. He came to my office with a very swollen knee. So x-ray is going to be first, just make sure if it's something really, obvious. But he was going to need an MRI.
Mhm.
So I said to him, true story. We can go through your insurance. They're going to mandate you go through 9 weeks of physical therapy twice a week. That's between $45 and $90 a copay for every visit. So let's say $200 a visit or a week, okay, for 9 weeks. Then you're going to get the MRI. You're going to be paying between $1,200 and $1,500. Or you could just go and get the MRI. It's going to cost you $500. We'll be able to see if you need surgery or if you need physical therapy. It's going to be the easiest and cheapest way. And you know what he told me? I want to go through my insurance because at least that way it's going to go towards my deductible. I looked at him like, I don't even know what to say. I don't even know what to say.
Yeah,
So
you're
I
like,
said nothing
okay.
because anything came out of my mouth was not going to be a nice thing to say. So I just shut up. Okay, nice, nice. So he did twice a week, 9 week. And then he kept coming in and complaining about the copay. And I said, I told you this is what was going to happen. Like,
Yeah.
I don't make this stuff up.
Some people do have trust in, conventional medicine and, insurance companies. But I think it takes a little bit of expanding your mind to see these other routes, maybe more efficient routes that you could take, with your health for sure.
And I think you get to a certain point in your life, especially if you're in your 60s and 70s now, you did live through a time when insurance companies actually paid for stuff,
Mm-hmm.
when doctors actually had knowledge, a lot more knowledge than they have now. And they didn't always revert right back to medication like they do right now. Totally, entirely different medical system, insurance system. Everything was different. We're not there anymore. We're never going to be there again, ever. Those days are completely gone. Now it's time to actually think about your health. Think about how much you want to actually put into your own personal wellness and care, and then use that money more efficiently.
Mm-hmm.
And if that means maybe not going through a standard insurance company, maybe going through one of those shares, I forget what they're called, but some of them are religious based, some of them are just, you kind of put all your money together, and when you put a claim in, everybody takes money from the pool and pays for it. We're in a different time now with insurance companies. I've never seen an industry, first of all, as a provider, I never saw an industry where you do the work and then you might get paid.
Mm-hmm.
Not only might you get paid, you might get paid what you actually put into for the claim, but you might not get paid anything. You know what I mean? It's the only industry is medicine, is that you might not even get paid for what you just did. And then the amount of people I had on my staff just because I was taking insurance, I had 3,000 patients in my practice. I couldn't make ends meet.
Wow.
Now I'm trying to get people healthy because that's my job. I'm trying to get you off your medications. I don't like prescribing medications. I don't like taking medications. So I am attracting people who are want to stay healthy, get off their meds. Now I'm getting letters from the insurance companies berating me for taking too many patients off their medications. They didn't read one note that I wrote. And my favorite line was I wasn't prescribing enough meds. And after my Italian temper got a hold of those letters and shredded them to pieces, I called my attorney and he said, you either have to start playing the game and keep people on their medicine, or you have to stop taking insurance because they will figure out a way to get your license from you because you're taking money out of their pocket. And that's when everything changed in my office. I stopped taking insurance. Everything is concierge. You get a super bill when you leave here. You get reimbursed from your insurance company, whatever your contracted, out of network prices.
Mm-hmm.
But my patients get the best care for that reason. Because now I don't have to wait for the insurance company to tell me it's okay to order a test or not order a test or something like that. My patients are much more likely to do the $500 MRI than they have to wait the 9 weeks and pay $1,500 out, because they've already gotten to that point where they understand how this works.
Mm-hmm. Mm-hmm.
I'm so passionate about helping people and getting them back to their state of health that I can't even begin to tell you how many times I stay up at night when I can't figure a patient out. When I have a patient who's so sick, or no matter what I'm doing, I can't get them better. It'll literally keep me up at night, and I'll end up in my office trying to research and figure out what is going on with them.
Wow. Do you have people from all over the world coming to see you?
I do. I have all over the country. I have a patient in Australia right now, and I have two from Italy that are on our waiting list.
Wow. With undiagnosed or misdiagnosed illnesses.
Yeah, because they haven't been able to find the root cause.
Now, what would you like to leave the audience with about anything we discussed, or just anything that's on your mind about what you do?
Be your own doctor, really. Research a lot. I know a lot of doctors, a lot of providers don't like Dr. Google, but sometimes it's the first place to start to see what your symptoms are and what you can do to try and get better. If you have a provider who's not listening, change providers. Functional medicine is going to be your best place to go because at least they understand. It's like I said, it's a missing piece. So nursing school, I went through nursing school. Nurse practitioner, I went through medical school. I didn't learn anything about functional medicine in either place. I learned more about preventing the disease process in nursing school. Didn't learn any of that as a nurse practitioner. But definitely, be your own advocate, be your own doctor, and if you feel like you have a tick-borne disease, if you want to see me, I'd be more than happy to see you. I just need to see a person once a year in person. Otherwise, I can do telehealth visits.
Mm-hmm.
But you can always go on the ilads.org site and find a doctor that's closer to you. And you can, call the office. I would definitely ask some questions, make sure that this doctor does treat mold, heavy metals, parasites, things like that. Because you don't want somebody who only knows how to treat tick-borne diseases either. That's only one part of the disease process. There could be so many other reasons why you're feeling so ill, including, like you said, Epstein-Barr, chronic form of Epstein-Barr.
Yes, Epstein-Barr. We didn't even get to talk about parasites. Well, a little bit because the spirochete. The spirochete is a parasite.
So the spirochete is a bacteria,
Okay.
but babesiosis is a parasite, another tick-borne disease. It's a parasite that lives in the red blood cell. So that would be a different type of treatment than the Lyme treatment would be. But regardless of where you live, even if you've never left the United States, you can still have intestinal parasites.
Do you suggest parasite cleansing?
I am a huge proponent of parasite cleanses.
Yeah.
So this is only one dog I have. We have 3 others at the house, and all 4 dogs sleep on the bed with us. And so the research shows that if you have dogs that go inside and outside and they sleep in bed with you, there's a good possibility that they have parasites and they're giving them to you. So my husband and I do parasite cleanses twice a year, just to be on the safe side. And we do things more natural, like black walnut, things like that, just to try and make sure that we're cleaning out ourselves as best as possible. I've never felt like I had parasites. I know I've had patients with parasites and I have never had those symptoms, but now it's a prevention.
Yes. Yeah.
You know,
I mean, don't we all have some degree of parasites present?
we all have parasites in our system.
Yeah.
We all do. No matter how hard we try to think that we don't, we all do. But some of us are going to have much more than others. Like I have one patient that was literally gaslit by several doctors telling her that if she didn't leave the United States, there's no way that what's coming out in her stool are parasites. And she gave me pictures of the tapeworm and the liver fluke, and then she brought them into my office. She was vomiting roundworms. Well, roundworms are still alive when they leave your body. They die quickly afterwards. This poor thing had just had lunch with her cousin, and when she felt fine. She wasn't sick to her stomach. She wasn't nauseous. None of that saliva forming under her tongue. She got into her house and suddenly had projectile vomiting. She just made it to the sink in the bathroom, and she said 2 long things came out of her, and the head poked out of the sink. So they were still alive when they left her. Do you
Oh,
know what she did?
what?
She actually pulled the cork out of the sink and measured them to see how long they. Nope.
I'm with you.
That would not be one of them.
Now I've heard stories, and I do parasite cleanse throughout the year as well. But yep, nope, not. That sounds like a severe case.
And she had all these sores on her head. One day she wakes up and, all of a sudden she has these deformities in her fingers. This is all from parasites. And she had gone to so many different doctors and they were just telling her that if she never left the United States, there's no way these are parasites. So she comes to see me and I had the pictures and I had the actual parasites, which, when I send them off to the laboratory, one thing your listeners should know, you're never going to get a positive parasite. I mean, I don't even know how to get a positive parasite. I literally sent parasites to Quest and LabCorp. And in both labs, I got back, it was a biologic. They knew it was biological, but they couldn't identify what it was. You could see it was a parasite. And I am not a parasitologist, but they don't employ parasitologists. So they have somebody who knows how to look under a microscope, do certain things, medical technologists, but they don't know how to identify parasites. So they just don't. So you have to go through a specialty lab to send these types of things out to that do have parasitologists that can actually tell you what it is. But at the time, I happen to have a nurse practitioner student with me. Her minor was in parasitology. And so she knew, I did not know what a liver fluke looked like at all. She knew exactly what it was. She knew what the tapeworm, I knew the tapeworm was easy to identify.
Wow.
But yeah, once this woman got on the right antiparasitics, and it was a process. So not only did we have to cover the parasites now, but we also had to cover the ova or the eggs that are going to be hatching in the next few weeks to cover those. And then several weeks later to cover those. So she was on antiparasitics for an extended amount of time. And you know what happened? All the sores went away. Her fingers, except for one, is no longer deformed. She no longer has that puffiness to her skin. All of her GI symptoms completely vanished. She doesn't have the explosive diarrhea or the excessive gas. I mean, her whole life changed just because
Wow.
just because I listened to her. It
Yes.
doesn't take that much. You just have to listen to your patients and never think you know your patient's body better than they do. They've had this body for only how many years? You're never going to know their body better than they do. And there's too many doctors out there that say, well, who's the doctor? And the patient should say, it's me. I'm the doctor. This is my body. I've been in this skin for how many years? Like, it's awful how they just, I don't know, they have that God complex, I guess.
Yeah. Yeah. You definitely have to find the right person for you who is going to listen and
I partner with you, you
Mhm,
know? I don't
mhm.
have my patients call me Dr. Pamela Cipriano or Dr. Cipriano. They call me Pam. We're like besties. By the time they're done here, we're like best friends, honestly, because we partner together. I want to get them better.
Yeah, I bet you're very warm. You're a very, very warm person. And
Thank you.
Mocha's gone now. I don't see Mocha.
Oh, Mocha's back over here where she was supposed to be. Oh, and she's eating my glasses. Thank you. That's why she's so quiet.
She found something to munch on. Just to wrap up, I wanted to know some of your wellness practices or rituals that you do in your life that you think keep you healthy.
So I don't eat meat. I haven't eaten meat now. It's going to be 20 years next year. But I'm Italian, so meat is a huge part of our diet and always bothered me ever since I was little. But then I read a book back in 2007 called Skinny Bitch, and it was written by two vegans. I don't know if you've ever
I read it
read the book.
too. Yes.
Did you? It's a very jovial book, very jovial. But there's two chapters in the middle of the book about the meat industry. And so I love animals so much that I've never watched any of those documentaries or read anything about it. But well, once I read it, I could not unknow anything that I read. So that was it. I just stopped eating meat. That made my energy level skyrocket. Like, it was the best thing I ever did. Another thing I did was changed my water. We have well water that was causing breast changes. So it was causing changes in my breast that were going to lead to breast cancer and down the road. So I did thermography. And what they found was it was greater heat, greater lymphatic congestion, and greater blood supply in one breast over the other, which was putting me at risk for breast cancer in about 10 years. So that's what I liked about thermography, is that it shows you the changes in your breast before it actually turns into a calcium deposit or turns into a mass. So you have an opportunity to reverse it. And so after changing my whole diet, at the time I was still eating fish. I got rid of the fish because of the heavy metals. I got rid of white wine because it really was no health benefit to it. And I don't know when I switched from red to white. I grew up on red wine. Got rid of plastic containers, plastic water bottles. Everything is stainless steel and glass in our house now. It was my older son, the one that had Lyme disease when he was younger, who said, it's going to be your water, because we had well water. We have a filter on our house. He said, you can't filter out heavy metals. And sure enough, he and my younger son got me a water distiller that sits on the countertop. It's through H2O Labs is the one that we use, but there's a number of them that you can find.
Mm-hmm.
When I started drinking that water, first of all, you cannot buy distilled water. I want to say that, because it comes in a plastic jug. A distilled water is unstructured water. So whatever it's sitting in, it's going to pull into it. So if you put it in a regular glass pitcher, all glass carries lead. You're going to end up with lead poisoning. The only glass that does not have lead in it is borosilicate glass. So distilled water has to be stored in borosilicate glass. So what I do is I have my stainless steel Yeti here. As long as I drink this throughout the day at 65 ounces, I get the amount of water I need in my system, and the stainless steel doesn't leach into the water.
Mm-hmm.
But I don't store the water in this. I store it in the borosilicate glass. When I switched this water, I didn't realize at first I was detoxing. I had like the underlying flu-like symptoms. And about 2 weeks later, my energy level exploded.
Wow.
I couldn't believe the amount of heavy metals I had in my system. And that was what was causing the breast changes. So I went for my thermography. I was going every 6 months, and there were no changes until I switched the water, and my breast tissue improved. So it's amazing how much your water and your food can make you sick, and how much your water and your food can actually give you health. I'm not somebody who just go to a restaurant and order whatever is on the menu. I am so annoying. I have to make sure it's organic, make sure, the pasta has to be from Italy, it can't be from the United States. Like, when I make my own homemade bread every week, because I make it with flour from Italy. We don't eat anything from the United States. There was a research article recently that came through that the bread that's in this country, beer that's made in this country, and wine is now completely infiltrated with glyphosate, which is the active ingredient in Roundup.
Mm-hmm.
So you really have to pay attention to what you're ingesting, because literally, there's no in between. It's either going to make you healthy or it's going to make you sick. My grandfather from Italy, I can't tell you how many times he said, you are what you eat. He said that so often.
So true. So true.
Yeah.
I connect with you on a couple things. I stopped eating meat after reading Skinny Bitch also way back in the day. And I was like, it was the chapter about the pigs. And I thought, I will
Yes.
never eat a piece of bacon ever again in my life.
Yes.
I did
Yes.
I was vegan for a while. And then I did go back to eating meat. I will say I did, but I still think about it all the time. It like left an imprint on my brain and my heart in that book.
Hmm.
And like you said, it
Hmm.
was very like, it was kind of funny all throughout the
Yeah.
book. And then you got that chapter and it was like, whoa, they really hit you with it.
Completely. Yeah. Just didn't
Yeah.
even know it was coming.
Yeah. And then the thermography, I've been doing that as well. And I really love that. I really love the thermography and just everything about it and like the process, like how easy it is. It's just so different than
And what it
traditional mammography.
shows. Yeah. What it shows. Every time I see a commercial now about, mammography preventing breast cancer, well, that's a lie. It doesn't prevent breast cancer, it finds breast cancer. But thermography actually prevents breast cancer because if you can make the changes you need in your diet and reverse that abnormality in thermography, you're not going to have an abnormal mammogram.
Yeah. They just told me that my breast tissue also improved over the last thermography. And I'm
Yeah,
doing, like you said, a lot of the same things, only drinking out of glass or, eliminating plastic, toxic chemicals, my cleaning stuff,
yeah,
my pans, my, going through
yeah,
all of it. So yeah,
yes,
I was like,
yeah.
yay, okay. I'm
Yeah,
doing okay.
isn't it a great feeling? But it's like it's so nice to know that that's what I love about it. And you could do your whole body, you could do just body parts. It's for male and female, but you actually know that what you're doing is working because you see the changes on this thermography. You see the improvement. You see the decrease in the heat. You see the congestion is clearing up. It's absolutely amazing in real time how we can change our future, literally change our future. If I continued to get mammograms and I didn't have a patient who came in and had thermography and I didn't see how easy it was to read these films, I would have never known about it. And in 10 years, I would have ended up with breast cancer because I
Mm-hmm.
wouldn't have known to make the changes,
Mm-hmm. Mm-hmm.
And with the 8 years of annual mammograms, which switched to every 3 years after that, because it was a research study that came out from the College of Surgeons saying that we're the only country that continues to do annual mammograms for average risk people. And that the amount of pressure they apply on the breast, if you do have a neoplasm, can actually rupture and cause metastatic disease. And that the recommendation was every 3 years, like in other countries. So I started getting my mammograms in every 3 years then. And then once I started with thermography and realized what thermography can show and how you can reverse the disease process, I never had another mammogram. And I won't. To me, it was literally giving me cancer more than anything else. The amount of radiation you get. No matter what they say, that's a lot of radiation to get every single year.
Right. Right. More people are talking about that now too.
Mm-hmm. Yep. I agree.
Well, Dr. Pamela Cipriano, this was a great conversation. I really appreciate your time. You're amazing.
Oh, I appreciate it. This was so much fun. I'm really, really happy to be on your podcast. Thank you so much for doing what you do.
Oh, thank you. I really appreciate you. And can you shout out where people can find you?
Sure. I am at the Practice of Health and Wellness in Thomaston, Connecticut. Our phone number is 860-880-2525. And you can find us on Facebook, Instagram, and I have a YouTube channel as well.
Oh, awesome. Okay, good.
Yeah,
Well,
lots of videos that I do.
yeah, maybe we can collab on a video of this podcast.
That sounds wonderful. I love that.
Thank you so much again for being here.
Thank you so much. Bye-bye.
Bye. Thanks for tuning into this episode of The Cinnamon Effect. If you enjoyed our time together, don't forget to hit that follow button on your podcast app and sprinkle a little love by leaving us a 5-star rating and a quick review. Your support means the world to me. For even more goodness, check out the show notes where you'll find links to some of my favorite products. And don't forget to visit thecinnamoneffect.com to connect with me directly or to grab your TCE Gratitude Journal, your next step towards a more grateful life. I can't wait to spice things up with you again next time. Stay vibrant, stay inspired, and remember to add a little cinnamon to your life every day.